Welcome to this explainer. If you or someone you love is staring down the barrel of a total knee replacement, looking at that long road to recovery can feel, well, incredibly daunting. But today, we're going to demystify the process. We are breaking down the exact clinical protocol physical therapists use to take you from day one post-op all the way back to your normal active life.
All right, let's jump right into the roadmap. We're looking at 4 distinct phases of rehabilitation, wrapping up with how to properly prep for a safe discharge.
You can think of this whole thing as a 10-week climb to the summit. We start with highly supported, gentle movements in the first couple of weeks, and then steadily progress through weeks 2, 5, and 7. Eventually, you'll be hitting heavy machine weights and walking completely unassisted by week 10. Every single step builds the foundation for the next. Starting off with Phase 1, early recovery. This covers the first 2 weeks right after your operation. So in these first couple of weeks, the big focus is really just managing pain and getting some basic mobility back. The goal is to keep your resting pain comfortably under a 4 out of 10. Mechanically speaking, we want to hit that essential 90-degree bend in the knee, and you need to be able to do 3 sets of 8 reps of your exercises without just totally gassing out. You also need to achieve independence getting in and out of your own home.
We start super gently here. You'll spend about 5 to 10 minutes on an exercise bike with absolutely zero resistance, just to get the joint moving. If you can't do a full circle, no worries. You just rock the pedals back and forth. To help with the bending, you'll do wall slides, using your good leg to assist. And to get that leg perfectly straight, you'll use manual pressure stretches and bag hangs for a low-load, long-duration stretch. Your physical therapist will even use neuromuscular electrical stimulation, those little sticky pads that zap your muscles, to wake up those dormant quads right alongside some gentle kneecap mobilizations.
Okay, quick pause here because this is absolutely crucial. During those early kneecap mobilizations, the protocol strictly dictates no lateral or side-to-side movements. Because of how the surgery is actually performed, pushing that kneecap side to side early on can seriously compromise your healing. Alongside the stretching, you're going to start waking up those leg muscles. We fire up the upper leg with short arc quads, just lifting the lower part of your leg over a bolster, and glute squeezes. From there, you'll progress to supported 45-degree mini squats, side-lying hip movements, and clamshells. We also bring in some basic balance work, like shifting your weight and sidestepping. But the absolute key here, for any standing exercise, you are heavily relying on upper body support, like a walker or a solid counter, to keep you safe. Moving right along to Phase 2, building strength, which takes us from week 2 through week 6.
Your milestones get a pretty serious upgrade here. We want to push that knee bend past 105 degrees, and when you straighten it, we want it perfectly flat at 0 degrees, completely powered by your own quad muscles. Your pain and swelling should be dropping off significantly now. And for walking, your gait should start looking normal again. A real heel strike and push-off, using the least restrictive device you can. Clinicians will also test your baseline quad strength, usually with an electrical stimulation burst right around week 4.
It's really cool to see how the exercises evolve in this phase. Those little short arc quads become long arc quads, and we introduce full straight leg raises. Instead of just shifting your weight back and forth, you're now doing active step-ups and step-overs on blocks that are 5 to 15 centimeters high. And, maybe most importantly, you are actively weaning off that upper body support.
You'll still be doing your clamshells and side-lying leg lifts, but now we're adding highly functional movements like repeated sit-to-stands and bilateral calf raises. You'll also use TheraBands to add resistance to standing terminal knee extensions, basically straightening your knee against the pull of the band. Add in some standing hamstring curls to balance things out, and as your muscle control improves, your therapist is going to keep raising the height of those step-ups.
Remember that exercise bike with zero resistance? Well, if you can pedal a full circle at the lowest seat height, it's time to add resistance. You'll keep up with your wall slides and bag hangs, but your agility drills are stepping up. You'll be marching in place while letting go of your support, trying out backward walking, and even doing forward lunges. With those lunges, you'll slowly go deeper and rely less on your hands as you get stronger.
All right, Phase 3, advancing mobility. We're now looking at weeks 5 through 8. By this point, we're looking for that knee to consistently bend past 115 degrees. Your therapist will be watching your maximal voluntary isometric contractions, which is really just a fancy way of saying they want to see a steady, powerful flex from those leg muscles. There's also a major clinical check here. If your bending hasn't improved by at least 10 to 15 degrees from your very first evaluation by week 4 to 6, your therapist is going to get on the phone with your surgeon to troubleshoot.
The name of the game in Phase 3 is external load. We make the bike even tougher by dropping the seat,
forcing a deeper stretch with every single pedal stroke. We're literally strapping ankle weights to your leg for your extensions and hamstring curls. You'll keep doing your four-way hip movements and start doing squats against a wall using a stability ball. Plus, your step routines get multi-directional now. You're mastering forward step-ups, side step-ups, step-downs, and full step-overs.
Your balance training goes up a notch here too. You'll step onto an unsteady balance board to train stability. You'll master standing on just your surgical leg with your eyes open, and your therapist will probably mess with the surface you're standing on to make it harder. Then we get into complex walking patterns like grapevines, sidestepping, and figure eights. As you nail these, you'll be pushed to do them faster and for longer to really mimic how you navigate the real world.
And that brings us to Phase 4, Final Steps, covering weeks 7 to 10.
The milestones here are honestly pretty awesome, especially when you think back to week 1. We're aiming for a full 120 degrees of knee bend. You should be walking foot over foot up and down the stairs with absolutely no assistance and walking unlimited distances with a totally normal stride. To cap it off, clinicians will retest your quad strength. The target is for your surgical leg to be operating at 70% of the strength of your healthy leg.
To hit those big strength numbers, you're literally graduating to the heavy gym equipment. You'll progress to actual leg extension and leg curl machines and do complex hip extensions with your feet resting on a stability ball. You'll revisit those standing four-way hip exercises, but this time, zero upper body support, none. Then you conquer the heavy machine leg press and calf press, finishing off with deep wall slides that include a brutal but effective isometric hold. These final agility drills get seriously demanding. You'll tackle the star excursion test, where you balance on your new knee and reach your other foot out in different directions like a star. Remember that single leg stance? Yeah, now you're doing it with your eyes completely closed. You'll also be running through rapid side shuffles, intense figure eights, and fast backward walking, constantly pushing the speed so your knee is ready for any sudden movement life throws at you. Finally, we wrap up with preparing for safe discharge.
Look, getting a new knee doesn't mean you just high-five your therapist and walk out the door. Your clinician will dedicate an entire session just to practicing safe kneeling with you, making sure your mechanics are spot on. You'll also get loaded up with vital handouts, guides on how to confidently navigate your local commercial gym, critical info on the risks of post-surgery weight gain, and nutritional guidance to keep that new joint healthy for the long haul. So, knowing that every single rep, every single step in this 10-week protocol has a distinct, progressive purpose, from that first gentle glide on a resistance-free bike to pressing heavy plates in the gym. Are you ready to commit to the climb and get your life back? It's a structured journey, for sure, but as we've seen today, it's a proven path to success. Thanks for hanging out with me for this explainer, and I'll catch you on the next one.